Good morning, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the special problems of the older athletes. We will discuss first about some common injuries, and in the next video we'll discuss about the list of common injuries, diagnosis, and their management. So first of all, what are the physiological changes of aging? Aging is associated with many physiological changes. There is decrease in muscle mass, which is also known as sarcopenia, directly correlated with the age decrement in strength, which leads to further functional impairment and disability. Then aerobic exercise, which is measured by maximal aerobic capacity, declines approximately 1 per decade after the age of 2025, and it is seen in both sedentary as well as competitive older athletes, and it is the best single marker of individual cardiovascular fitness. And in most of the physiological system, aging doesn't result in significant impairment or dysfunction in the absence of pathology. However, stress and physiological reserve can lead to an inability to complete a task requiring near maximal effort. And list of physiological changes associated with aging. First, we are having decreased skeletal muscle mass, that is sarcopenia, decreased basal metabolic rate and energy expenditure. There is graying and thinning of hair, decrease in skin, ligamentous and tendon elasticity. There is reduction in height. There is changes in speed of cognitive processing and retention of new information. There is slowing of reaction time in presbyopia and presbycusis. So there is a aging musculoskeletal system. So there is a decrease in bone mass and bone strength, like there is loss in the cortical and cancellous bone, which can lead to further fractures after the age of the 50. Women are more prone than men. And muscle mass also decreases, number of cells also decreases, which further decrease the strength. And also the articular cartilage undergoes the degenerative changes, so which can further lead to osteoarthritis. Intervertebral disc also shows the traumatic changes, especially in the central region of the disc, like changes in the protoglycan, water, nutrition to disc, which can lead to disc herniation and changes in its shape and volume, so which can further lead to low back pain, stiff neck, loss of mobility, stenosis, degeneration of facial joints, uh, which is common with aging. Tendon, ligament, and capsule, which are composed of fibrous tissue, these can lead to, and it can lead to, we can say, low energy ruptures of the rotator cuff and biceps, patellar and Achilles tendon, and which can lead to failure, with aging. And there are some factors which can affect the aging, like changes with the normal aging process are also found in master athlete, not in only in the sedentary or active people. But master athlete continue to maintain the muscle mass, which depend on the training and volume. So these are some of the uh, we can say age-related changes which occur uh, with aging, like in muscle, in there's decreased strength or area or mass or loss of type 1, but the competitive master athlete try to maintain the type 1 type 2, and they do the strength training or training volume. Cardiovascular, there is decrease in cardiac output, stroke volume, maximum heart rate and aerobic capacity. But in my case of master athlete, there is low resting heart rate, high systolic, and decline in HR maximum. And in bone, there is decreased bone mineral density, but in also but bone mineral density also decrease in comparative master athlete. Then we are having the aerobic capacity, that is 10% per decade, and in case of master athlete there will be 5% per decade. Performance between ages 20 to 30, there is near maximum speed and performance, and in case of master athlete there is decreased speed, strength or overall performance. Nutrition, there is decreased energy requirement and there is increased protein requirement in master athlete. In water, there is decreased thirst mechanism, and but there is increased output by the kidneys. So usually in case of athletes, they uh, definitely before or after workout they weigh, so they replace the weight loss with 2 cups of water for each pound lost, and also monitor the color of the urine. So master athlete is more prone to acute or obvious injury, secondary to slow rate of healing and recovery and low compliance with rehabilitation. The master athlete appear to slow down the secondary to decrease in training intensity, time or motivation as compared to younger competitive athletes. Thank you.